When Utahns voted on Medicaid expansion at the ballot box in 2018, one of the driving arguments made by supporters was on the impact the expansion would have on some of Utah's most vulnerable residents. The argument seems to have held some sway with the electorate, who passed Proposition 3 to support and secure the interests of their families, friends, and neighbors. Not only did 53% of Utahns support the proposition, 59% of House and Senate districts did so, according to an analysis done by the Utah Health Policy Project. Despite these numbers, the Utah legislature insisted that the taxpayers had not fully realized the cost of the expansion, and it was thus their responsibility to remedy that error. Of course, the initial estimate from the Governor's Office of Management and Budget had suggested the 0.15% sales tax increase would be sufficient. It was only in the post-election analysis that the shortfall appeared, rising from $10 million in 2021 to $84 million by 2025. Senate Bill 96, the remedy that was eventually passed into law, cost the state more money. A full expansion would see the state bear 10% of the costs, with the federal government picking up 90%. Right now, by covering tens of thousands fewer, Utah is responsible for 30% of the cost of care, which results in the state spending more overall. This is meant to be a temporary situation, however, as the state is sure that CMS, the Centers for Medicare and Medicaid Services, will approve a Section 1115 waiver, which would allow for the 90% match at the restricted expansion level. CMS under the Trump administration has been supportive of, quote, innovative approaches to Medicaid expansion, including the waiver granted to allow work requirements and enrollment caps in Utah. In the case of the higher federal match at lower expansion levels, however, they've not approved similar requests from Arkansas and Massachusetts. If Utah is right about CMS support, they can prepare for legal challenges from these states. In a recent Vox article discussing Utah's Medicaid expansion, Elliot Fishman, who worked on Medicaid waivers for the Obama administration, explains that if Utah can get this deal, other states must be able to as well. Further complicating matters, the Section 1115 waivers are temporary, only lasting for 5 years typically, according to a Kaiser Family Foundation article on the subject. If the next administration is unsympathetic to Utah's waiver, they don't have to reapprove it, which opens up the potential for another lawsuit, this time with Utah on the filing end. Let's hope the fiscal impact analysis on the cost savings from reduced expansion factored in legal fees. The voices of ordinary citizens, especially those who are most directly impacted by the revision of the proposition, don't seem to be enough for the Utah legislature. If this is the case, perhaps supporters of a full expansion need to collaborate with another stakeholder impacted by Medicaid expansion, but one who might have a bit more sway with the legislature. Hospitals. It might seem like poor taste to shift any focus away from the low-income residents of Utah who face the consequences of the legislature's decision in terms of literal life and death. But the focus on this group alone does not seem to be sufficient to convince the Utah legislature to adopt the will of the voters. The impact of Medicaid expansion on hospitals has not been covered in great detail in the discussion around Utah's expansion. A rudimentary content analysis of 20 articles on the topic as it pertains to Utah only contained 2 references to hospitals or other healthcare institutions, while 17 discussed budgets or costs or the taxpayers of Utah, and 14 covered the people at the center of all this who stood to gain coverage. Though media coverage hasn't focused on them, hospitals have just as much a direct stake in full expansion as potential Medicaid enrollees, and it boils down to 2 words: uncompensated care. Hospitals eat the costs of care for uninsured people who come to the emergency room and have no ability to pay for that care. Though a financial motivation is not the lens many healthcare advocates wish to advocate through, it's the language the legislature speaks. Hearing it spoken by a powerful interest group, maybe a few of Intermountain Healthcare's 25 active lobbyists, would matter in the pursuit of full Medicaid expansion. According to their 2017 financial summary, Intermountain Healthcare performed $675.1 million worth of uncompensated care, $276.9 million in bad debts, which arose from patients unwilling to pay, and $398.2 million in charity care for patients unable to pay. Research done by the Commonwealth Fund in 2017 compared the overall reduction in uncompensated care in expansion states to non-expansion states. Though of course every state is unique, if the aggregate findings, a roughly 40% reduction in uncompensated care, are applied to IHC, roughly $270 million a year would be saved. Though that money obviously doesn't get transferred directly to the state budget, the fact that IHC and other health systems in the state would be able to shift hundreds of millions of dollars to more productive activities, and more importantly for the sake of this argument, tax revenue generating activities, should reduce the alarm raised over state budget concerns. The financial benefits to hospitals that come under a full expansion scenario extend some of the state's interest even further. A study in health affairs examined the relationship between Medicaid expansion and hospital closures and found that states which expanded Medicaid experienced decreased odds of rural hospital closure. Utah has done exceptionally well in keeping its rural hospitals open, in part through dedicated state programs for rural care. Financially healthier organizations reduce the need for spending state money on these programs, which is yet another factor not included in the fiscal impact analysis done by the state. With all that said, how does this impact you if you don't need Medicaid? You've got coverage through work, and you certainly aren't worried about the bottom line of any hospital, and a shortfall in state funding, should it even arise, doesn't bother you too much. The state has a surplus anyway. But guess what? You're impacted too. A report from the Kaiser Family Foundation found that up to 2.3% of the cost of your private insurance can be explained by uncompensated care being pushed to private payers. And along with the state and local funds inefficiently trying to make up for some of the uncompensated cost, you're getting hit. No, it may not amount to much, but if you haven't been convinced yet, maybe this will be enough to push you to join the continued fight for full expansion.